It's Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
News of a possible universal vaccine. How close is that, and what kind of game changer is it?
Well, what's happened is a spin-off of this whole pandemic is that there's so much attention being put on vaccine development. It kind of was a sleepy area, they're working on hepatitis C and other things. And then COVID comes along, and it just accelerates. So what they found at Walter Reed Army Institute in Bethesda is that they may have identified a type of coronavirus vaccine. It's called the spike ferritin protein vaccine. It's kind of lines up the spike protein in some kind of order. The immune system responds actually much better, and in animals right now, it looks like it covers all the coronaviruses. So, it would maybe take care of all the variants, plus all the coronaviruses that cause SARS and MERS and the common cold. It's very encouraging. It's very early, but I think it just shows you what the technology can do.
We've been talking a lot about different variants. This Delta variant, the Surgeon General mentioned it by name, said the unvaccinated very vulnerable to that. What's different about this variant, and is it more concerning?
This is remember we talked about the old UK variant, B117, which is now the Alpha variant. That spread much faster. There was always a question whether it was slightly worse than the regular virus. Delta is like way worse than that. It's taking over in the UK, so it's even more transmissible. Early reports are that it might be harder, a more harder disease to treat, and not as good survival. So that all remains to be seen, but this is not a good move with Delta taking over. It's about 5 or 6% in the United States already.
All right, let's get to viewer questions. Is it safe to return to the health club if vaccinated, and should we still wear masks at the health club?
Well, this is a good practical question today because everything is opening up. Yeah, you can go to the health club now with no limits on how many people are there, and you do not have to wear a mask if you are fully vaccinated, both vaccines.
All right, next question. I received my first COVID shot 3 months ago. I received the Moderna shot. I am going on an international trip in November, which is close to the assumed booster time period. I feel there is an advantage to getting the viral-based Johnson & Johnson shot for my 6 to 12-month booster. What are your thoughts on that subject?
Yeah, this person is thinking a little bit too far ahead. We don't know when a booster shot is going to be needed after you had the Moderna or the mRNA vaccine. That would be the Pfizer also, or if you had the J&J vaccine. That is yet to be determined. The other thing is, even if you need a booster at 1 year, it's not like at 365 days there's no protection. It would be a gradual drop-off. So if you have to travel someplace in November, you had your shots in March, very likely, you're not going to be anywhere near needing a booster at that particular time. But, this is an evolving process, so we have to stay on top of it. But I wouldn't, there's no way to answer really the question, but they really don't have to worry because that person will have plenty of time to get a booster if it's needed, and they may not even need it.
All right. If you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Have a good day.
Thanks, doctor.
Great day.
Hey, Paul.